Cheers.
Hi, this is Kinga Digs Deeper, and today I am with a special guest. Meet Dr. Sheena.
Hi.
Let's see a dentistry from a little bit different perspective. Dr. Sheena, tell us a little bit about your baby, which is Alora Dental Spa, medical spa. How does it work?
I had this vision ever since I got done with dental school that I wanted to combine beauty and wellness together. So wellness starts with your oral health. Everything enters your mouth and goes into your body. Cosmetics has always been something that I've always been interested in, but I also want to make sure that, the patient is taken care of as a whole. We're making sure all cavities are gone, all disease is gone. We're maintaining their oral health as well as giving them that perfect balance of a beautiful smile. So I said, how can I combine these two? What started off with me doing small cosmetic cases and smile transformations, and then patients asking me, well, what can I do about these lines and these lines? So that's how I kind of formed the med spa aspect of it. We do have a medical director here, Dr. Sood. He is a board certified plastic surgeon, and we do work together on our cases. So, when patients just come in for a smile reconstruction, we also talk about, their lips, where their gum stays, where their cheek lines are, and we kind of work together as a whole to give them a good overall image, as well as correcting their smile, getting rid of their cavities, and giving them something to really smile about.
Yeah, it does make sense because, teeth are one thing, but the position of your teeth also reflects on how your face looks like, right?
And people just think, people do Invisalign for just cosmetic reasons. I always tell my patients, Invisalign not only improves your teeth cosmetically, it puts them into the home they actually want to be in. So it corrects your bite, how they function, overall where they're placed. It just gives you a more comfortable feeling. You reduce risks of having TMJ problems, bone loss in the future, a multitude of things. You're able to clean your teeth better and then you're preserving them better. So it not only gives you that, yes, perfect, beautiful, straight smile, it puts your teeth where they really want to be and you're able to function at your max.
So I know you're looking through this. I know I put a load of questions on you, but I just wanted to make sure you
I know I'm trying to see if I can see not the same thing. So I really want to, because the patient that's coming in right now, funny thing is he has a misconception about, he wanted to come here, but he's like, I just want to make sure that you guys do fillings and cleanings, because he's like, what's a dental spa? Like, I don't want a spa.
Exactly. So let's talk about this. I have a toothache. I call you, you can fix my tooth, right? But during this fixing,
what's going on?
Besides fixing your teeth, you can have other treatments.
So one misconception about dental spas or cosmetic dentistry is that it's all about luxury or vanity. In reality, it's about wellness and confidence. So yes, we do fix your teeth here. Yeah. That's what our first priority is. But, we do cater to people that have high anxiety. We cater to people that want more of a spa-like experience when they come to a dentist. You don't have to have the extra amenities, but we do provide a hot towel service at the end, so you can kind of clean up. We do provide the noise-canceling headphones, so it cancels out the sounds of the drill and everything else.
You can watch the TV, your favorite show.
Yeah, who doesn't want to do that and take some 20 minutes away from kids and home and all your responsibilities elsewhere. You don't have to make it just a chore in your chart. It can be something that as enjoyable as it can be if you're fixing a cavity or getting a crown done or getting your smile whitened. And
and I know this firsthand because you took me here and we did a deep cleaning, right? And during this deep cleaning, I had my paraffin wax.
So we do have a full comfort menu. So we offer paraffin wax for the hands. Like I said, the warm towel, aromatherapy, noise-canceling headphones, eye patches. So we kind of just make it a whole rejuvenating process for your body.
But besides that, do you also have an esthetician who works here?
We do. So, and it comes in, hand in hand, like the whole eyebrow, oral beauty, facial beauty, all comes together. So the esthetician, actually, we offer microneedling here that she can talk more about it, but it improves your wrinkles, acne scars, fine lines. I've seen the results. You do a package of 3, 4 to 6 weeks apart, and wow, like you are looking like a new person. We also do VI chemical peels here, which, also take off years off your age. So we're just here to provide a one-stop shop. And that's how I kind of came about the idea of Alora, because moms are busy.
Yes.
People are busy. You have kids.
Yes.
I have kids. And I have a 5-year-old and I have a 7-year-old, and I have all these responsibilities with my PTA, my business. I do have other offices as well. So it kind of makes it hard to schedule all your appointments.
Yes.
So here we try to provide a one-stop shop. You can come in, you can get your kids cleaning done. We do see kids all ages. My youngest patient is a 1.5 old, I want to say. So I do lap exams. And my oldest patient is 93. So we see people of all ages here. We do family dentistry. We also have, like I said, a board-certified plastic surgeon. We do have an esthetician here as well. So it's as much as you want to do, a little bit less or more, it's up to you.
So I have an idea now for all those ladies. Like, sometimes it's hard to convince your husband. It's like, hey, I need an appointment for esthetician.
Yeah.
You just go for your dental
Yeah.
checkup, and then you can do your Botox, you can do your facials. And this is amazing. Like, you tell your husband or your boyfriend or whoever, you just like, hey,
I just went to the dentist.
Yes, I need my dentist appointment, and that's what's
Yeah.
happening. You do. And you can relax. They have coffee. They have a beautiful place here.
And you actually would be surprised, because some of our female patients have come in and then their husbands have come in after, and they absolutely love it. There is a thing called Botox. So
Yes.
men are doing it as well. And Botox isn't just used to treat cosmetic things like wrinkles. Yes, it helps obviously with the wrinkles and the crow's feet, but we also use it to treat a lot of TMJ.
Yes.
A lot of my patients come in and they grind and clench their teeth very badly, to the point where they're grinding them completely down. Me and Dr. Sue do work together. So not only do we offer the night guards that you can wear, but we do offer the TMJ Botox, where he injects into the masseter muscle, which actually stops the people from clenching. And a lot of our male patients do get that done. So when we don't get much pushback. Once they come in and they see the place, they actually do love it. And they get to watch their favorite show. They could watch football, which we don't want them watching at home anyway. They can watch their sports highlights, the whole 9 yards, or they take a nap, whatever they want to do. But they do take advantage of the spa as well.
Let's go back to the kids. You said lab exam. What does it mean?
So sometimes when the kids are really young, we usually recommend kids to be seen when the first tooth comes in the oral cavity, or about 6 months of age. And people say, oh my gosh, 6 months? That's so young, right? So, but we want to get them used to the dentist. We want to get them acclimated to the environment, because if it's something that a child sees for the first time at the age of 7, they're very high anxiety.
Yes.
Think about seeing a dental chair, all the tools, and you've never seen something like that before. And then think about a 6-month-old that's been acclimated to this since they were so young, that they think that getting your teeth cleaned is normal and it's fun. So it's more of a preventative thing. So when parents come in, I do have sometimes the moms sit right across me with their knees knee to knee. So their knees would be like this. The head of the child would be on my lap, and I would be doing the physical examination here, just to make the child feel more confident. I, as a child, probably didn't go to the dentist as regularly as I should have. I was born in London, so I was born in Europe, and then my parents, got more acclimated to taking me, but I didn't probably go at the age of 6 months. So when I had to go when I was 7, and my mouth was so small, I had to get a tooth removed. It was so traumatizing.
Yes.
So I was like, I want to make it, opposite for others. So my own kids love going to the dentist. They love brushing. They love flossing. They love using their fluoride rinse every night. And when I say, hey, you have to come see mommy to get your teeth cleaned, they know why.
Yes.
And so I want to spread that awareness to other parents, other young families. It's better to bring them at a younger age. We're able to catch issues a lot earlier in life and make things less traumatic for them.
So it's funny you mentioned you were born in London, right?
Yeah.
So tell me a little bit about this. I did not know that.
Yes, so I was born in London. I moved to Florida at the age of 7 with my parents. I went to the University of Florida for undergrad, and then I actually went to the University of Toronto in Canada for dental school.
Very nice.
And then I did my residency at the University of Connecticut, which was kind of on the border of New York. And on my residency, I focused on, pediatrics, cosmetics, all things general, Invisalign. So I was able to get more training and become a better provider to the patients.
So what makes you choose this place? I mean, Illinois.
I know,
And not
everyone.
Florida.
That's
It's
the
so
number one
cold.
question everyone says. Why did you move from Florida
Yes.
to Illinois? Well, I met my husband here.
Oh.
And one of my best friends actually got married, and she moved to Illinois. And I came to visit her. And when I was visiting her, I did meet my husband in Illinois.
So that made it easier.
And he kind of convinced me to stay. My partner would say that I kind of convinced you to stay because, you know, then I had this opportunity to do Alora Dental Spa. So, you know, it's a toss-up.
Awesome. We are super glad we have you here, because taking anxiety out of the equation of all the worries that when you go to the dentist, it's super important. It doesn't matter what type of provider even you are, right? If it comes to like health services, these things are stressful.
Very stressful. And then, I mean, if you Google on the internet, dentistry does give people high anxiety in general. I mean, the tools we're using, the sounds of the drill, all these things. So when we take all those things into account with the high anxiety patients, we use gentle techniques, we use the state-of-the-art technology, we do intraoral scans so they're able to see everything. We have the newer type of x-rays so we're not gagging them. Just the little touches that we put in. I think any patient, even if you're not highly anxious, appreciate those things.
Yes, you have all those fancy tools. So that's good, because also for people, I think when they watch you on social media and seeing all this like equipment that you have, I know they probably have questions like, why so many x-rays? But you have this video, like, you cannot imagine. I mean, you want to...
Yeah, I mean, I wish that I didn't have to take x-rays and I had an 8-ball and I could tell you, like, okay, I know exactly what's going on. But, you know, it's a really key tool in diagnosing people's treatment. And that being said, the ADA just came out with a study saying that, you know, you get exposed to more UV rays stepping onto an airplane. Or even eating a banana. So we don't even have to use lead aprons anymore, although I do have it here if a patient is highly concerned, but there is like no actual reason to be concerned about the rays from the x-rays anymore.
So you don't have a supervision, you cannot see through tissues, but you have a superpowers. You're a mom, you juggle the business. How is this like for every day?
You know, people say, and so like you say, social media makes it look so easy. Really, behind the scenes, there is a lot that goes into it. I do have a team that is very supportive, that we all work together to make sure that your experiences are the best that we can provide. We are giving you our utmost attention. But with that being said, I do have a family to balance as well too. Both of them, all three of them, I guess, are my babies, my 2 kids, and my husband's 4th baby, you know. So it's hard. So, you know, I kind of time manage. I do like working out, so, you know, I make that a priority in the morning. When no one is awake, I get everything ready for school. I go for an hour, and I do see a personal trainer.
So what time you wake up?
I know, I wake up at 5 a.m. Yes, and that's the best part of my day because it gives me so much energy. It's my time, and then I get home, and I get the kids ready for school. And, you know, my husband is a good supportive partner as well, so we do work together in terms of our drop-offs, our pickups. It doesn't all just happen. I do have help. And I'm really appreciative of it. We have family that lives here that helps out as well. So, you know, it takes a village, but we make it work.
Let's go back to younger yourself. What advice would you give yourself?
If I was younger, I would say I'd tell myself to slow down a little bit and, you know, enjoy the process of learning. Mastering the skill of dentistry was, you know, difficult enough. You were definitely a perfectionist. You see the littlest flaws in things. But I think that, you know, building empathy, communication skills, all that comes with experience, because that ultimately is what the patients need as well. Not only do they need your skill, they need a combination of you know, being empathetic towards their needs, what they really want. Are you listening to them? Are you communicating well with them? So it all goes together. And I think that I learned that over time. So when I was younger, I was so focused on how can I master every single skill in dentistry? You know, from root canals to crowns to seeing children, how the drill works, how every new piece of technology is working. And then I kind of learned along the way. Like, I formed these relationships with my patients that I take a long way with me. I've had some patients for, I want to say, I've been seeing them for 15 plus years. And so, you know, really listening to them, and I think communicating with them and just treating patients as a whole really does make a difference. So I would probably tell my younger self to slow down a little bit.
But I think this is the key. When you're younger and you have the strength and power and ability to learn, you want to master those skills that you're learning. And then when you're going into your life, you learn about people, and it's not only like the tooth that you see.
Yeah, you have to build their trust.
Yeah, and you see the person, and then every person is different. Somebody sits on your chair and they're terrified. Some people talk to you, some people don't want to talk, right?
Yeah, and everybody can come in all different moods. One thing I've learned is that, you know, whatever is going on outside of the operatory, when I walk in, my all ears and focus are on that patient. I don't like to focus on what's going on outside, what happened yesterday. We do kind of all in the office do a morning huddle, which I think is really important. We leave everything else going on behind us.
I think that's
because you know you're really there to focus on your patients, and if your mind is not there fully, patients can feel that.
Yes, definitely.
So, and we can feel that from patients too, because sometimes they've had a long day and they had a lot going on. So we kind of try to judge and see what's going on, you know, talk them through the process, maybe not try to overwhelm them. We do give the option of, you know, if it's a very large treatment plan, Kathy is really amazing about, you know, saying, hey, we'll give you a call back tomorrow, and, you know, Dr. Patel can go over it with you on the phone, and you can come back in and we can go over it again. Like, we don't want to say, make your decision right now in this moment. Because, you know, they may have some other things going on. They may want to think about it. They may want to talk to a spouse about it. We're very, like, you know, patient with the patients.
Thank you so much. It was amazing to talk to you a little bit, like, behind the scenes of everything that you do, because it's, like you said, it takes a village in a regular day to be prepared to, like, I see you walking every time I'm here before you walking with a smile. You always, like, even though, like you said, sometimes it's not a good day for you. I mean, today we have cold weather and we just want to smile.
I know, and today my son actually woke me up at 5 a.m. and I didn't have to wake up today, but, you know,
yeah,
that's
happens.
life.
And then you sitting here smiling, looking cute and hot and sexy, how we supposed to look and feel every day. we girls, that's how we supposed to be this.
That's it. And that's what we want to make you feel like here. So not only do we will take care of your beauty needs, we do take care of all your oral wellness needs as well.
Thank you so much.
You're welcome.
Kasia is here. Let's talk about Kasia's work here at Alora Dental Spa.
Yeah. So I've been an esthetician for over 17 years. I've been working here for about a year. The office that I worked at previously, doctor retired, so they decided to close the spa, and then I joined Alora after that.
So what do you think about this link, dental office and spa?
I love it because Dr. Patel, she's very, very passionate about cosmetic work for dentistry. And if you think about it, I mean, it is everything here. So it's teeth, and then skin complexion, and then skin texture, and Botox, and everything else kind of falls into one place.
Yes. Give me your best tip now, because it's a winter time. Let's say it's winter. We had a first snow just now, like a day ago. So what's the best treatment to do now?
Pretty much anything that you cannot expose your skin to the sun in the summertime. So microneedling, any kind of laser treatments, chemical peels are great. We do have to get all of that dead skin cells off of our skin after heavy summer and heavy sun. Microneedling, honestly, and chemical peels are my favorite treatments.
What's the best way to go about it? I know it's like one thing it's not gonna make your skin glow, but I'm sure if you're consistent with it. So how many treatments you should do for your face?
Well, everybody's different. So it depends on what you are trying to improve. If, let's say, you've had microneedlings done for many, many years, like once in a while, maybe twice a year as a touch-up, it's fine. But if you're trying to correct acne scars or deep wrinkles, then it's probably 3 to 6 treatments.
Gotcha.
Or if you have great skin and there's really nothing to improve, you do want to keep it that way. Then you'll just come in once in a while for a microneedling, maybe twice a year, just to kind of keep up with your skin. I mean, if it already looks great, there's nothing to improve. We don't have to improve anything. We can just keep it that way for a very long time.
Yeah, so now it's the season where Thanksgiving is coming, Christmas is coming, and all other celebrations. I'm sure you're gonna have, or you already have, the packages, like deals for the year. So do you remember from the top of your head?
Yeah, we have actually all of our services are 20% off for the summer,
Oh,
for
very
the winter specials. So you can give me a call and we can talk about your potential treatments
And
over
you
the
can-
phone, and I can ask a lot of
Can
questions.
you build my treatment plan?
Over the phone, it's probably going to be a little hard. I like to take a look at somebody's
Right.
skin, but with my experience, I can probably, by asking questions, kind of figure out what you would need. But the final determination would be when you come in for your treatment. I'll take a look at your skin, and then we'll go from there.
So now it's the end of the year, so it comes with ending of benefits for insurance, right?
For dental insurance,
For
yes.
dental insurance. So schedule your dental checkup,
Yes.
and then you can check your skin, right?
That is true. Yep, I'm here. I also do the front desk duties at Alora, so I can answer questions about dental and aesthetics.
Since Kinga digs deeper, let's talk about girl stuff, women's stuff, I guess. You're a mom also,
Yes.
right?
Yeah, here at Alora, we're all working moms.
So how hard it is? It's not hard. It is hard, right?
Well, it's
a challenge?
It's a challenge because my daughter, she is very passionate and very ambitious. So she actually is involved in a lot of after-school activities like choir and drama, violin. She plays. She's actually on a swim team.
Oh, wow.
And she goes to Polish school on Saturdays. I do beg her to drop one thing she doesn't want to. But yeah, she's busy. So I mean, with my husband at home, like we're trying to
Yes.
figure it out. Like drive her here, drive her there, and all those swim meets on a weekend. But we make it work.
So fun fact, you just probably heard that Kasia, well, her name reveals it. She's Polish. So if you need any help and you're not so sure, like, if your English is perfect enough, because we all want our English to be perfect, which it's hard with our hard European accent. But you can call Kasia and speak Polish, and she will explain you everything in Polish.
Yeah, I'll do my best.
Thank you, Kasia.